how do we improve a muscle imbalance? Well, once you've identified there is a muscle imbalance, and any physio should be able to help you to do this, the goal is to be able to then try and improve the posture such that the muscles over a long period of time will start to regain that muscle balance. Obviously, if there are tight muscles, yes, obviously some active stretching of those muscles will definitely help to correct a muscle imbalance. And this is where tools like the bodybolster are very, very effective in targeting specific regions of the body to help there. It also requires a bit of exercise involved to try and strengthen those muscles that may be a little bit weak, or they're not stabilising as well as what they could be. So the next thing we've got to look at is from a pain management perspective. We work in workplace rehabilitation, and we quite often work with what we call the tail end claims. And the tail end claim are those people who have been on compensation for many, many years, 3 years or more. Now the problem with these tail end claims is that they're quite often reliant heavily on the health care system, and they rely on what we call passive strategies, where a passive strategy is somebody else does the work for them. They take a pill for their medication, they go for a massage because somebody else is doing the work. For those people who work in the rehabilitation industry, there's a bit of a saying that goes around there. There's what we call active rehab, where you're actively involved and you tend to get better, where there's passive suffering. Whereas if you rely on others, then then there's a tendency for your condition to get worse. So I guess the advantage of using tools like the bodybolster is it can assist in that active rehabilitation. So when it comes to somebody who's got a bit of a back pain or a bit of a neck strain, instead of taking the medication, we look at things like stretching, improving posture, some active contraction of the right muscles, the deep cervical flexors from stability point of view, your transverse and your multifidus muscles from the lower back. So what we know is there are some tools out there, such as the bodybolster, which can be used as an adjunct as part of a management strategy, which can assist in this active rehabilitation. There are a number of tools out there that can assist in improving stability and so forth, and they all have their advantages, in one scenario or another. The Swiss ball is a tool that has been used quite extensively over the last few years, and there are advantages to using a Swiss ball in certain situations. It does, however, present a number of limitations, particularly when it comes to posture. I don't know if anyone's ever tried to sit on a Swiss ball for 8 hours a day and maintain their posture. It's quite difficult to do. So there's a tendency to slouch after a while, which is sort of neglecting the purpose in the first place. Tools like the bodybolster, however, are more of a corrective tool. They're very versatile, easy to travel around, and what you can do is you can position these such that it allows you to maintain those postures over a longer period of time. You can also set them up so that you are actively contracting, so you are getting a bit of a workout throughout the day, which works well as well. The modern environment that we work in, and that we spend it a lot of times in cars and in offices and slouching on the couch, basically that environment requires that we are sitting a lot more these days than we ever have before. Now the problem with this is the postural muscles of the spine, the transverse abdominis and the multifidus muscles, these muscles are pretty much designed to be working all the time, but every time you sit down in the chair or you're driving in the car, then those muscles, your back is already supported, so there's less tendency for those muscles to be actively working. And as a general rule when it comes to muscles, what you don't use you lose. So the problem there is if we're not actively using these muscles over time, the strength and the stability of these muscles can start to deteriorate. So if you are one of these people that does sit for long periods of time, either through driving or in a workplace, then the exercise is obviously important to try and regain the strength and the activation of these muscles. Using tools like the bodybolster is fantastic here, because you can position it such that it teaches you to actively contract these muscles, which if maintained over a long period of time can definitely help to improve strength and stability of the spine. So for those people who are sitting for prolonged periods of time, whether it be in the office or driving, there is a tendency for your pelvis to rotate slightly backwards. We call this posterior pelvic tilt, which now causes the back to slouch forward. To correct this, what we should do is either move your buttock further back into the chair, which now turns your pelvis slightly forward, which helps to maintain a neutral spine. Alternatively, you can use tools like the bodybolster. What you can do is just place this just underneath your tailbone, which then naturally leads your pelvis into that anterior tilt, which can then help you to maintain that posture over a long period of time. Whilst posture is important in maintaining joint stability and muscle balances, if you're an active type person, or you sit for prolonged periods of times, these muscle imbalances can occur not just through prolonged postures, but through playing sports and living an active lifestyle. So it is important that we also incorporate regular stretching as part of our management strategy in looking after our muscles, bones and joints. One advantage to using tools like the bodybolster when it comes to stretching is it does allow you to work through a greater range of movement with your joints, allowing you to target more muscles, to be more specific and hit those regions that need to be targeted.